Hi, my name is Michelle, but I go by Mimi, and today I'm going to do my health history on my patient volunteer, which is my fiance. Today's date is 4/5/2024, and the time right now is 23:15. Here's the room scan. And let's start the interview. Hi.
Hello.
How are you?
Good, how are you?
I'm great. Thank you for asking. My name is Mimi, and I'm going to be your nurse practitioner today.
It's nice to meet you.
Nice to meet you as well. Is it okay if I interview you for school?
Yes.
And is it okay if I upload it on YouTube as unlisted for grading purposes?
Yes, ma'am.
Okay. And okay. Can you tell me your first name and last name
Hannah Rost,
and your date of birth?
5291.
Okay. Do you have any allergies to medications or anything like that?
I do.
What are they?
Penicillin.
Penicillin. Okay. And what happens when you take penicillin?
I get hives.
Okay. Thank you for that. Tell me, what brings you in today?
I'm here for a yearly wellness check.
Wellness check, okay. When was the last time you had a wellness check?
Last year, same time.
Same time last year? Great, okay. Here for a wellness. Okay. Can you tell me, do you have a history of any present illnesses or anything?
The only thing I've been diagnosed with is hypothyroidism.
Hypothyroidism?
Correct.
And when was that diagnosis?
December 2023.
2023, okay, thank you. Are you taking any medication for it?
I am.
What's the name of it?
Levothyroxine.
Levothyroxine. Do you know the dose?
I do not.
You know the dose, okay. Do you know how many times a day you take it?
Once.
Once a day? Great. Would you say that you're pretty consistent with taking it?
Yes, every day.
Okay, thank you for that. And is there anything bothering you today at all?
Nope, nothing.
Oh, great. Okay. So for our first visit, I'd like to do a full, complete health history, if that's okay with you.
Yeah, absolutely.
All right, awesome. Just so that we can get to know each other, and then any other time that you come and see me, it'll be more of a focused assessment. So let's go down the list, and can you tell me about any past medical histories or?
C. diff.
C. diff. Tell me a little bit about that.
Had it in 2005 and then 2 times in 2008.
So you had 2005 times 1 and then 2008 times 2.
Correct. 2005 I was hospitalized for it.
2005, so hospitalized. How long were you in the hospital for?
About a week.
I'm so sorry that happened. How old were you then?
About 15.
Wow, 15. How old are you now? Actually, sorry about that.
About 32.
32, thank you. Wow, that has been tough at 15 years old. You said you got hospitalized, right?
Correct.
For how long?
A week.
A week? Wow. Both times or just?
Just the first time. Yeah, second time I had medication.
Medication. Which medication did they give you?
I'm not sure. It tastes like a nickel.
Okay. That's gross. Do you have any medical history or like family? And do you have any personal history with psych or
No.
depression, anxiety, anything like that?
No.
No? What about a family history of that?
Yes.
Yes? No, tell me a little bit about that.
My grandmother's side. It's my mom's side.
So is that your paternal grandmother? We'll say?
Correct.
All right.
I don't know my father. So I don't have any history on him.
Okay. All right. We'll get down to that part. So aside from the hospitalization that you had in 2005 with the C. diff, have you had any other hospitalizations that you're aware
No.
of?
Just a couple surgeries.
You weren't hospitalized for those surgeries?
Oh, yes. Actually, I had a gallbladder removal in December of 2023.
Gallbladder in December of 2023.
Correct.
Tell me a little bit about that. What happened?
I had shortness of breath. I had a lot of stomach pain, lost appetite,
Okay.
fatigue.
Wow. Okay. Wow, such a young age for that. Okay. How long were you hospitalized? At that time?
I think 5 days,
5
maybe
days.
a week, somewhere in between them.
How was your recovery?
Oh, it was great.
It was great.
Yeah,
Did you have good help?
I did. I had wonderful help.
Okay. Have you had any other surgeries?
Just a couple knee surgeries.
Knee surgeries. All right. Right and left, or which knee?
Multiple times on the left knee.
Surgeries on left knee. Okay. And do you remember when?
October 2010 was the first one.
October of 2010. Okay.
And they were finished by 2013.
By 2013. So in that 3-year span, how many surgeries would you say you had?
3.
3. Okay. 3 surgeries. Okay. Okay. Thank you. And then let's move on to the OBGYN. This one is going to be like a little mini version of women's health. Do you have regular periods?
Yes.
You do? Okay. Are you taking any birth control or anything like that?
No.
Period. So every month you have a regular period, no issues?
Correct.
Any type of
No.
menstrual symptoms or anything like that?
Just cramps.
Great. Cramps. Do you
5
take
days.
any? I'm sorry. Go ahead.
A period for 5 days.
Times 5 days. Thank you. Sorry for interrupting. And then you get cramps.
Correct.
Do you take any medication? Some, like Tylenol over the counter or anything like that? Yeah.
Ibuprofen.
All right. Cool. Any like abnormal bleeding, super heavy, spotting? Just regular.
Just right.
All right. Thank you for that information. Any other history? Like, you have your ovaries, you have your uterus and all that stuff? No.
All that.
Okay. Any pregnancies or anything like that?
No pregnancies.
No pregnancies. And no birth control, correct?
Correct.
Do you want any information on birth control?
No. Okay. Thank you.
Okay. All right. And then, are you sexually active though?
Yes.
You are. And you sexually active. Do you practice safe sex, condoms, or
Yes.
you use condoms?
No. Same sex.
Safe sex, yes. Okay. Oh, please don't start laughing. Okay. So, let's go to immunizations, vaccinations. Are you up to date?
Yes.
You are. Great. When was your last tetanus shot?
2022.
2022. Great. You know those are every 5 to 10 years. To
Yes.
stay up to date. Okay.
Yeah, the Tdap.
Did you get your flu shot this year? The seasonal flu shot?
I did not.
Did not. Would you like that today?
No, thank you.
No flu shot?
No, thank you.
Just FYI, the flu shot helps prevent, it's highly recommended and it helps to prevent, if you're exposed to the flu, it helps you avoid getting the flu.
Well, thank you. I'll keep that in mind.
Okay, thank you. And you're up to date with all of your immunizations, correct?
Correct.
All right. Next, we're doing really good. Okay, do you have any medications that you take every single day?
No. Well, just the thyroid medication.
Levothyroxine. Okay. And then do you take any well, I guess I should be more specific, more like vitamins, any supplements, herbal supplements, or anything like that?
Magnesium, iron.
Nice. Iron, okay.
Zinc.
Zinc. Are you taking the iron for a reason?
Yes, for the hypothyroidism.
Okay, that's part of it. Okay. Okay. When were you diagnosed with hypothyroidism?
December 2023.
Okay,
After the
good.
gallbladder
Okay,
surgery.
I'm sorry about that. I just want to make sure. Okay, I have that. And then, how often do you take your zinc and iron?
Not as much as I should.
Like daily or every other day or something?
Probably twice a week, 3 times a week.
Twice a week. Do you happen to know what the recommended dose is? No dose. Okay.
I'm not sure.
What about the recommended frequency usually?
Probably every day. But I don't know.
I think it's daily. That's okay. We'll get it right. We'll get you right by the end of this visit. Sorry, my video cut off for some reason. I don't know why, but I'm just gonna start where I left off, which was
Penicillin.
no. I was telling you to take your vitamins. You need to take the zinc and the iron daily.
Yes.
Okay, great. All right, and then the penicillinality, yes, you're correct. And then, okay, let's move on to family history. I want to make sure it doesn't cut off. Family history, just the first and second generation. So can you tell me the health history of your mom?
Yeah, she has hypothyroidism.
Hypothyroidism. Oh, she does too.
Correct.
Okay, all right, so family history of that. All right.
High blood pressure, high cholesterol.
Okay, anything else?
Heart palpitations.
Okay. Anything else? All right. What about your paternal? I'm sorry. What about your? Yeah. I'm sorry. What about your father's health history?
I'm not sure.
No. Okay. Are you close to your father, or are you? Is that a picture, or?
Never been around.
Never been around. All right. Okay. What can you? I forgot to ask you about your living situation.
Mm-hmm.
Do you live with your mom? Do you live alone?
I live
or
with my fiance.
live with your fiance? Okay, great.
She's amazing.
Oh. What about? I was gonna ask you another question. Did you come here alone today?
I did.
You did? Okay, you
Yes.
drove yourself. All right.
Yeah, I
cool.
drove myself.
All right. Sorry. And then, can you tell me a little bit about your maternal grandmother, like her health history?
There's some depression there.
Okay.
High blood pressure. High cholesterol.
Okay.
Trying to think.
That's okay. Take your time.
Vertigo.
Vertigo.
Headaches. GERD.
Okay. Anything else you want to add?
No, that's pretty much it. Not
Okay.
anything about.
What about your maternal grandfather?
He has a history of strokes, heart attacks. We have different diagnoses in our family.
Okay.
So out of her 7 siblings, some of them have different diagnoses.
7 siblings. That's a lot. It's kind of like my mom's. There's a lot of. There's like 13 of them. It's a lot. That's a lot of kids, huh? Speaking of which, do you have any children?
No.
No, and no pregnancies.
Correct, no pregnancies.
My bad. What about your? Okay, last 2 in this section. A paternal grandmother first. Yeah. So I think your mama's mama.
I have no idea.
Me, okay.
My grandparents are from Germany and Poland. So who knows? They could have been exposed to all sorts of things.
No worries at all. Does that go for grandmother and paternal grandfather? Is unknown?
Yeah.
Okay, no worries at all. And then I want to ask you some other questions. Just a few other ones would be tobacco use or vaping.
None.
Okay, what about alcohol use?
Very minimally.
Minimally? Like explain like socially, like if you go out with your friends or
Maybe.
at home
Maybe
after work.
1 or 2 drinks a month, if that.
Okay, all right. One
It's
or
not
two.
good for hypothyroidism.
Drinks a month. This is accurate. Okay, and then what about caffeine?
Coffee. No energy
Any
drinks.
type of caffeine. Oh, so
Yeah.
coffee.
Coffee.
Okay.
No energy drinks though, just coffee.
No energy drinks. How much coffee would you say you drink on a daily basis?
Depending on work, 2 to 3 cups.
2 to 3 cups. Okay. Like full cups,
Yeah.
small cups, or,
Large
and
cups.
is it black coffee or
No.
just with creamer?
Yeah, a little bit of creamer.
All right. And you do this about how many times a week? How
Mm,
many days a week?
3 to 4 times, sometimes 5 times a week, depending on what my work schedule is.
Ooh, that's a lot of caffeine, huh?
Mm-hmm.
Yeah. Do you have any alternative Would you like some alternative information on how to maybe decrease your caffeine intake?
That would be great.
Okay, all right, we'll get that for you at the end of the visit, okay? Info on caffeine. All right, that's great. What about any type of illicit or recreational drug use?
No, ma'am,
Do
no.
you smoke weed? Do you?
No, ma'am, nothing.
You know, I'm interested and curious to know what's your occupation?
I'm a police officer
Oh, are you? That's awesome. Where do you work?
in La Mesa.
Holla. Okay then. All right. Do you love your job?
I love it so much.
Okay, that's wonderful. All right, let's move on to social history. You have a fiance. Great, congratulations on that. When did you get engaged?
May of 2023.
Yeah, okay. All right. Is the date coming up?
Hopefully.
Yay. All right. Sexual history. Just one partner, correct?
Correct.
So, all right. Any history of like any STIs, like in the past, any STIs, okay.
Oh, nothing.
When's the last time you had blood work?
I get blood work done yearly for my job, just to make sure there's no hepatitis or anything like that. But I had my blood drawn about 7 weeks ago.
Nice. Or were you checking?
Full blood panel,
Nice.
T4 and the TSH.
Oh, is that where that diagnosis came from?
Correct. Yeah, it came after I had low white blood cells and low iron after surgery. I was septic during that time.
Oh man, I'm so sorry to hear that.
So I did my blood work and then started the thyroid medication. And I'm up for a follow-up to ensure it's the proper dose.
Okay, good. Well, I want to tell you, first of all, good job on taking your iron because that decreased iron is super important. Have you been having any feelings of have you had any issues with feeling tired?
Yes.
Yeah. So that's one of the symptoms of low iron. So I want to make sure that you're taking that. And then also the low white count. You gotta make sure that your immune system stays boosted. The zinc, the mag, and then we'll offer some other things to help you keep a boosted immune system. Okay. And then I was gonna say something else, but I forgot. But we'll come back to it if I remember. But any military history?
No.
No. All right. Awesome. I figured out that I don't have much storage, so my phone keeps dying, so I just switched to her phone. All right. I'm going to pick up where I left off again. Oh, whoops, my notes. Military, thank you. Oh, no, diet and exercise. You were doing hot yoga.
Yep.
How many days a week do you go?
Minimum 2.
Minimum 2.
Try 3 to 4. Just depends on the work schedule.
2. All right. I think 3 to 4 is a goal. Let's make that your goal. Let's do 3
I
to
would
4.
love that. And I think those supplements would help because I'm exhausted after work. Fatigue,
Okay.
nausea, headaches.
All right, we'll do that. 3 to 4. When I do my plan at the end, we'll do a goal for your exercise is going to be 3 to 4 times a week in the hot yoga, and then we'll add some supplements at the end. Okay, and then all right. How's your sleep?
I don't sleep well.
You don't sleep well. Tell me about that.
I haven't slept well for a while, but
What's a while?
a long time,
Like months,
8 years.
weeks.
8 years. But it's gotten better in the last 4 years. But it's still not as much as I would like. A lot of tossing and turning, a lot of joint pain,
Okay.
a lot of back pain.
A lot of back pain. Do you think that's so? What do you think contributes to your lack of sleep?
An overactive brain, high cortisol.
Okay. Do you do what do you use to help you sleep?
Different musics.
Okay, that's great. That's a good one. Give me an example.
Just different hertz.
Do you mean like frequencies
Correct.
and like,
White
okay,
noise, different
White-
frequencies,
okay.
things like that.
beautiful. Does that seem to help you?
It does.
Okay, what do you do? I'm not even gonna ask you, do you have stress just because of your occupation? But how do you manage your stress?
Yoga.
Yoga, beautiful. Then I think it would be very important for us to put a plan of care together for you, especially for 3 to 4 weeks, or 3 to 4 times a week for hot yoga. And perhaps that will help you with sleep
That'd be
along
great.
with the stress, so a combination of things, right?
Yep.
Do you have any type of spiritual affiliation?
No.
No? All right. Anything affecting your activities of daily living?
No.
No? Okay, wonderful. All right, let's move on to the review of systems. Constitutional, how are you feeling in general and overall? How's your overall feeling?
Good. Just everyday joint pain, back pain.
Yeah, but how do you feel overall as a, like just,
Like 100%, 90%?
well, like, are you feeling depressed? Are you feeling anxious about anything?
no.
Are you just having a wonderful day?
No,
Are
it's
you
a great
wonderful week? Okay,
Yeah.
okay.
It's great.
All right. And then also, do you have a headache right now?
Not right now.
No, not right now?
I typically
Okay.
get them before bed.
And what do you do for that?
I have 2 different medications I can take, but I try not to.
Are these medications daily or are they
As needed.
PRN as needed?
Correct.
What do you know the names?
Topamax
Topamax, okay,
and sumatriptan.
and sumatriptan. Do you happen to have those doses?
I do not.
What about the frequency?
Just as needed. It just depends.
When you do need it, do you take them like once a day? Do you end up taking it?
So the Topamax is supposed to be daily,
Oh,
but I
okay.
don't like the side effects. The sumatriptan I take as needed, but I have to be careful when I take it because it knocks me out.
Oh, it makes you real tired. Yeah,
Correct.
that's one of the side effects of it.
So I have to plan it accordingly if I'm going to work or if it's early in the morning.
When's the last time you took either one of those?
Probably 4 months ago, 6 months ago.
About 4 to 6 months ago.
Mhm. Right before I had my gallbladder surgery.
Okay, not too bad. 4 to 6 months, not too bad. Some time. All right, and let's continue on with this. So, any pain in your eyes, any blurry vision, or anything like that? Any difficulty seeing? All right. What about your ears? Any pain in your ears? Any ringing in your ears? Any unbalanced feeling like dizziness or anything? Heaviness or fullness in your ears?
Occasional ringing, but that's pretty normal.
Okay. Your nose, any issues with your nose, like stuffiness or like runny,
No, just consistent nosebleeds.
consistent nosebleeds?
Mm-hmm.
Okay. When did that start?
8 years ago.
What prompts them?
I don't know. We haven't been able to figure it out yet.
Okay. Is that something? Okay. All right. How often do you get them? Once a week? Twice
It's
a
just
week?
random.
They're just random.
Yeah.
When was your last one?
6 hours ago.
6 hours. I was making sure it's recording. Sorry. 6 hours ago. Okay.
Probably.
And how long do they last? Are they like? How do you manage it?
It depends. If I can catch it early, then it's pretty quick. But there have been times where it's bled for 10, 15 minutes.
Yeah. But this last one, how long was it?
For about 3 or 4 minutes.
3 to 4 minutes.
Yeah. I just have to sit down. I can't walk around. I can't do anything. Can't bend over.
Any lightheadedness or
Yeah.
dizziness with that? Okay. Is that the only time that you have those symptoms?
No.
The lightheadedness and dizziness?
No.
Do you feel that all the time?
When the headaches come on. Typically, the headaches are followed up with nosebleeds.
Okay.
And
But aside from a nosebleed or a headache, do you normally feel lightheaded or dizzy?
since I started the medication with levothyroxine, yes.
You feel dizzy and
Mhm.
headache? Okay. Okay. All right, we're gonna come back to that. Your throat, is your throat bothering you, or any mouth sores or any difficulty swallowing?
No.
Moving down, any cardiovascular history? Like, do you have any chest pain or okay? Any difficulties breathing? Okay. What about your tummy? Any abdominal pain or anything like that?
No, good to go.
Any issues when you urinate? No burning frequency, no blood in your urine or anything. Okay. Do any of your legs hurt? Your legs, your arms
Oh, body
bother
hurts
you? I mean, like when you're walking, you
all
mean?
the time.
Why?
Because I'm got. I carry 60
Oh.
pounds on my hips.
Yeah. You know, physical therapy or, you know, yoga is
Yoga
good for
really
you,
helps.
really.
Yeah.
So because of your equipment, yeah,
Correct, yeah. It's the way that it sits.
that probably contributes to your back pain.
Correct, yeah. Lower back pain, sciatic, knee pain.
Okay. Are you able to take that equipment off during the day and try to get a break from it or anything?
You
Like during your
can.
break or something?
You can try, but the way the universe works is the second you take it off, you get a call, so.
Yeah, that's true. That's true. Maybe we can try to come up with a plan, like maybe on your lunch break or
Yeah.
like try to get relief from that in some kind of way.
It's a good idea.
I'm trying to figure out something. If I think of something, I'll let you know. And your any like abrasions or scrapes or any type of sores on your skin?
Nope, just standard scars from surgery.
Okay, awesome. What scar?
Got my gallbladder scars, 4 incisions on my abdomen, and then
Your knee?
multiple scars on my knee. 1, 2, 3, 4, 5, 6, 7, 8.
That's
9.
left knee, correct?
Correct. Yeah.
All right. Anything else?
No.
All right. And then, do you give yourself a breast exam?
Yes.
Okay, good. Any tenderness? Any issues with that? No leakage or anything, right?
No.
All right. Neurologically, any abnormal dizziness?
No.
Okay. And any depression or anxiety or anything? Okay. Any endocrine disorders
No.
that you're aware of?
No.
Any hematologic or lymphatic disorders that you're aware of?
Not that I know of.
No swollen lymph nodes or anything like that in your neck? Okay. And then I know your allergies are penicillin. Anything else immunologically speaking? No? All right.
No, they have had conversations about Hashimoto's, but that was ruled out.
Okay, those ruled out, right?
Well,
All right.
as far as we know. Something
Okay.
brought up again.
Then I would imagine that is ruled out. All right, I am almost done. Thank you so much for being super patient with me.
Thank you for asking so many questions.
Yes, of course. I actually think I'm done. I don't know. Okay. Okay, sorry.
That's good.
I just want to make sure.
Yeah, absolutely. Whatever you need.
Okay. Any issues with your activities of daily living, or did I ask you that?
No.
Okay.
No, just depending on the headaches.
Oh, I wanted to ask you, any food allergies?
No, not that I know of.
Any seasonal allergies?
Yes.
Which ones?
Nasal congestion and
But when does that happen?
random times.
Oh,
Depends.
okay. Like
A
in
lot,
the
lot,
summer?
of, lot of dust and dirt. Like we have construction
okay.
right now, so construction, a lot of dust, dirt.
Okay, so dust, dirt, pollen, and things like
Correct,
that.
yeah.
All right, thank you. And then I wanted to ask you, do you use your seatbelt when you're driving?
Yes.
Are you texting while driving?
No.
Safety first, right?
Always.
All right. Do you own any guns at all?
Yes.
Standard questions.
I don't like them, but yeah.
Are there any children at home?
Yes.
There are. How many?
2.
2. What are their ages?
They're 9.
They're 9. Are they twins?
They
Oh
are.
my goodness. Okay.
A boy and a girl.
What are their names?
Sanai and Elijah.
Oh, I love that. Okay. So in regards to the gun safety that I give to all of my patients, are your guns locked and put away?
Yes, I'm a law enforcement officer.
Were they, were they, the children don't have access to them, correct?
Correct, they do not. They're
All right.
locked up in a safe.
All right. Do you own a pool?
No,
There's no pool on the property?
no,
All right, cool. Any history of domestic violence
no,
in your partnership or partner violence?
no,
No,
not
you
at
need to call security?
no.
Okay, good. All right. Thank you for allowing me to interview you. It was
Yeah.
a pleasure to meet you. It's
Absolutely.
a pleasure to assess you, and I think that is all.
Beautiful. Thank you. Appreciate it.
I think that's it.